and infertility specialist. Anyone amongst you foreigner, please raise your hand. Okay. So today our topic of discussion is anemia during pregnancy. So anyone amongst you know about anemia? What is the definition of anemia? WHO definition. Decrease hemoglobin level up to what? Below 8 or 7. Very good. Anyone else? Do you have lecture in class about anemia? No. So hemoglobin level less than normal. What is the normal range of hemoglobin level? 13 to 16 in male, 13 to, and in female 11 to 14. Yes. So below 11 is less than normal. Normal is starting from 11. Got it? Then there are 3 types of anemia according to WHO: mild, moderate and severe. Okay. HB less than 11 or above 9 is known as mild anemia. Okay. HB between 7 to 9 is moderate anemia, and below 7 is severe anemia. Okay. What are the symptoms of an anemic patient? Symptoms. Patient present with what will be the symptoms? Fatigue, lethargy, breathlessness, body aches and pains, low grade fever, anorexia, weight loss, palpitations, mood disturbances, mood variations, anger, irritation, sleeplessness. These are all the symptoms of anemia. So the patient can present with any one symptom. Okay. You must focus on the symptoms of the patient while taking the history. Now what will be the clinical signs of anemia? Clinical signs. These were symptoms of anemia. Pallor. Pallor at where? Conjunctiva. From the conjunctiva in the eyes, you will look at the. How will you look at the conjunctiva? With one hand or with two hands? On general physical examination, first you will see the hands of the patient, palms of the patient, and compare with your hands. A doctor must be having HB more than 11 so that he or she can compare the hands of the patient with herself. Okay. So you will compare the hands of the patient, palm of the patient with yourself. That are they pink or not? So first pallor sign will be looked at the palm of the hand. These should be pink. Okay. Then second one is on the conjunctiva. You will use both your hands in the daylight. If there is no daylight, you can't distinguish between jaundice and anemia. In the good daylight, in sunlight, you can check for the jaundice as well as for the pallor. And you have to use both your hands. You have to ask the patient to look upside up to the roof. And when the patient will look up to the roof, you will use both your thumbs and you will pull them down to check the sclera. Okay. This is the part of the general physical examination, and if you don't know the general physical examination, you can't pass the exam. So symptoms of the patient on history and clinical examination, signs of the patient are very important. Okay. So pallor is the main sign for anemia, and symptoms vary from mild, moderate to severe. Shortness of breath, palpitation, fatigue, easy fatigability, body aches and pain. These are the severe symptoms of anemia. Okay. Then comes types of anemia. Do you know the types of anemia? What are the types of anemia? Can anybody one? macrocytic anemia and normocytic anemia and megaloblastic anemia. The most common anemia during pregnancy is iron deficiency anemia. More than 70% of the female have iron deficiency anemia during pregnancy. So can we prevent anemia during pregnancy?
Yes, ma'am.
How? Diet. By healthy diet, having iron rich diet. What do you think? What is the iron rich diet? Tell me the names. Green, green leafy vegetables, liver, meat, red meat, palak, spinach, apple, good, pomegranate, juice, red meat, yes, egg. Egg is a source of iron. Anything else? Carrot, root beets, चुकंदर जिसे कहते हैं, रूट बीट्स, किशमिश, डेट्स, nuts, dates and उसको क्या कहते हैं अंजीर को? फिग्स हाँ, फिग्स, अंजीर, watermelon. Everything that is red will give iron to your patient. Tomatoes, red watermelon, carrot, red meat, strawberries. Strawberries are a very good source of iron, and this is the season of strawberry. Okay. So what will you tell your patient? What type of diet you should take? Iron rich diet, and you will tell the name of that diet to your patient, and you should give her a vast option. So if your patient is not affording, she is from very poor socioeconomic status, how will you tell her that you should take this diet? No. There is a diet that is not so much costly, that can increase a hemoglobin level. Spinach, yes, carrots, dates. Our people think that dates are not good for baby or for mother. That is wrong myth. You can ask patient to you can counsel patient that you can that the patient can take dates 2 with each meal. So 6 dates daily she should take during pregnancy. 2 morning, 2 in the lunch, 2 at the dinner. So patient if a patient takes 6 dates daily during pregnancy, she should not have any signs of anemia. So dates are the most economical, cost-effective thing that can cure anemia. Okay. So you can counsel your patient about anemia, about the diet rich in iron. Next question is, if during first trimester you send the labs of the patient and her hemoglobin turned out to be 7, how will you treat her? And she is having vomiting, nausea, she can't tolerate any medicine. If there is severe anemia and patient is symptomatic and she can't tolerate any medicine, and during first trimester iron is not indicated, because iron having free radical that can hinder the growth of the baby. So these free radical toxicity can be prevented by not giving iron during first trimester. What we have to give during first trimester? Only folic acid. Only folic acid. And if the patient is anemic, we can confirm the type of anemia. If it is iron deficiency anemia, then to replace the iron stores, you can give iron during first trimester if the patient can tolerate it. First, check the complete blood count. Her HB is less than 11. Then send iron serum ferritin level. If it is low, then you should prescribe iron by taking history. If the patient is not having nausea or vomiting, she can take iron during first trimester, but with care, because usually patient got stomach upset while taking the iron tablets. So in first trimester you must be very careful about anemia. It is very difficult to treat anemia during first trimester. Then comes in second and third trimester. The choice what we have to give to the patient depends upon the patient condition, her IQ level, her education level, and her tolerability, that she can tolerate medicine or not. So, do you think that during pregnancy there are some volume changes during pregnancy? Have you read in your physiology what physiological changes on the cell level are going to happen during anemia during pregnancy? Increase plasma level, and this increase plasma level can dilute the hemoglobin level, and there is naturally decrease in HB level while patient is taking good diet because of this physiological changes during pregnancy. So patient can develop mild anemia in pregnancy, and her HB level is if less than 11, you should take prophylactic. Say for her HB is 10.5, and she said that I have no symptoms. Will you give her iron or not during pregnancy? Diet is very good, but diet cannot compensate during pregnancy, because during pregnancy demand of iron is increased, demand of HB is increased due to this plasma volume increase. So you will give prophylactic elemental iron 60 milligram per oral daily for prophylaxis of anemia. As if she will not take iron during second trimester of the pregnancy, start of second trimester, whether her HB is 11, she will be ended up with a pure anemia. Her HB will fall to 9 at the end of the 34 week or 35 week. So prophylactic dose of elemental iron is 60 milligram. You will start from second trimester whether patient HB is normal. Then comes the therapeutic dose. If the patient is hemoglobin level is less than 11, then you will give therapeutic dose of elemental iron, and this therapeutic dose is double than that of the prophylactic dose. 60 plus 60, 120. Okay, that is therapeutic dose, and prophylactic dose is half. So you should counsel the patient that your HB hemoglobin level is normal, but with the passage of time, during pregnancy, when the fetus is going to enlarge in weight and size, you need more hemoglobin, you need more iron to compensate your stores should not be replenished. So you will counsel the patient, as mostly you know that due to this digital era, patients are well educated. They can argue with you that doctor, my HB is 11, why I should take supplement, why I should take iron. Okay, you must know that iron is we give iron for two purposes, for prophylactic, for therapeutic. If HB is normal, we give for prophylactic purpose, that her HB should not be dropped at the end of the pregnancy. At the time of the delivery, her HB should be 11. So this is prophylactic dose, 1 tablet daily she will take elemental iron. But if her HB is less than 11, 10.5 or less than 10, 9, then we should prescribe her double dose of iron. And if the patient is symptomatic, she is having shortness of breath, palpitation and fatigue, and her HB is less than 9, and she is entering in the third trimester, and she is symptomatic as well, and she falls in the category of severe anemia, then we should go for IV iron. IV iron is the iron that increase hemoglobin level up to 1 with the infusion of one drip of iron. So we will put her on IV iron according to her HB level, and IV iron can increase HB level early as compared to the oral iron. You got my point? Then, if the patient is admitted for the C-section or normal delivery and she has been planned to deliver after 2 or 3 days and her HB is hemoglobin level is 7, then IV iron will not work. Why? IV iron give result within 21 days. Today you have given IV iron drip to one patient and her HB will improve after 21 days. It will take time. Okay? And if you have a plan to deliver a patient within 2 to 3 days, IV iron will not work fastly. And her HB is, if her HB hemoglobin level is less than 7 or 7, you will give her blood transfusion. That should be packed cell transfusion, red cell transfusion, RCC transfusion. Okay? So this depends upon the patient. Iron, we can improve hemoglobin level by giving oral iron, by giving IV iron or intramuscular iron, by giving blood, but it depends upon patient period of gestation, clinical symptoms, her severity of the disease. All these things should be considered before giving any therapy to the patient. You got my point? Any question? Understood? Everything understood? So do you have any patient of anemia in the ward? So you will take history of anemic patient and all the points, all the symptoms you will ask about her, especially her eating habits as well. Do you know what is the major cause of anemia in our society? Poor diet and poor hygiene. Worm infestation can cause anemia. What is the most common worm that can cause anemia? Hookworm. Hookworm. So deworm करना भी आपका फर्ज है. पेशेंट को deworm करने के लिए इसको मेडिसिन देंगे. Can you give medicine for to deworm patient during pregnancy or not? During first trimester contraindicated. During second trimester you can give medicine to deworm the patient so that her HB level should not be dropped. So you can give albendazole, mebendazole 100 milligram. You can give 3 tablets stat or you can give 1 tablet BD for 3 days. Okay? So you should deworm the patient during second trimester or third trimester. Due to poor socioeconomic status, due to poor hygiene, our patient have worm infestation usually. So prophylactically WHO recommend in second trimester you should deworm every patient of pregnant patient. Any question? Yes. Effects of anemia to the fetus and to the mother should you know that first to the mother. If the mother is anemic and she is going to deliver a baby, do you think that her delivery will be very smooth? First, she will have poor labor pains, dysfunctional labor pains. She will not deliver normally because her uterus is not more powerful. She have delayed progress of labor. Okay? First thing, yes. Yes. I will discuss fetus as well. Second thing, if the patient is already anemic and she went into labor, mild degree of blood loss during delivery, that is known as postpartum hemorrhage, can result in death of the patient. Because she is already anemic, she have no reserve of iron, and small degree of hemorrhage can cause death of the patient. And she can went into postpartum hemorrhage more rapidly than that of the normal patient. Her uterus will not contract easily because of anemia. And if the patient is severely anemic, her HB level, hemoglobin level is 6, she can went into anemic heart failure. She can went into, due to palpitation, arrhythmias, she can went into anemic heart failure. And effects on fetus. Fetal growth will be affected badly. Fetus will be IUGR, low birth weight, low IQ level, her memory will be less, her IQ level will be less, he will have attention deficit syndrome, hyperactive attention deficit syndrome, and the fetus will have anemia as well. And intrauterine fetal demise can occur due to severe anemia. And liquor of the baby will be reduced. Yes. Yes. Sheehan syndrome. Yes. So these are the effect on the fetus. If you counsel the mother that your baby will be very small, will be low birth, will having low IQ level, then she will be motivated to take iron tablets. If you counsel her that your health is not going good, you are going to weak, she will not take any supplement. But if you counsel her in a way that your baby will be good size, your baby will be healthy, if you will take supplements, then she will take supplements. So this is the way of counseling the patient to take supplements. Female are very touchy about the size of the baby. They wish that their baby should be good size, beautiful, healthy, gapu baby should come. So you can counsel the patient about health of the baby as well. Okay. Any question? Yes. Neurotube defect vary from mild, moderate to severe. If meningeocele, meningomyelocele, spina bifida defects, so this depend upon severity of the disease. Hydrocephalus. So we send the baby after delivery to the ped surgery department. Pediatric surgeon decide about the surgery of the patient baby, and prognosis depend upon the severity of the condition of the baby. Yes. So if the baby has mild hydrocephalus, mild meningeocele, not meningomyelocele, then the prognosis is good. But if the baby has meningomyelocele with severe hydrocephalus, then the prognosis is bad. Any other question? Thank you so much.